Ester Davis. Top of the day to all of you, our listeners around the world, locally, regionally, and wherever you are. We have a very, very special show for you today. It is with one of our distinguished persons that is working on something we are all involved with. It's called mental health. Please welcome to the broadcast Dr. John W. Burruss. How are you?
Hello, Ms. Davis. I am well, and thank you
so much for your time. I know you're busy, but thank you so much for your time.
You're very welcome.
Let's start with mental health. That's your specialty, and you are the CEO of Whittaker.
That's correct.
What should we be doing this month, and what do you give us an opening statement on your goals, your progress, what is happening with mental health? We're all interested in what you have to say.
Well, thank you for the opportunity to talk about this. It's a critically important topic. We have come a long way since the days of, people being put in the back room and isolated and people put in the asylum. So we've made great progress with eliminating and reducing the stigma of mental health conditions, but we've got a long way to go. There are still a lot of populations and folks who don't want to acknowledge that this kind of medical condition exists. And so our job at Whittaker is to certainly, first of all, be the provider for people who reach out for help, but also to do what we're doing right now, which is to let the community understand that these conditions are every bit as treatable as other medical conditions with good outcomes, and that anybody can be afflicted with them. It's not a weakness. It's not a character flaw. It's just something that we have to deal with. And so getting that word out and getting word out that there's help available is exactly what we're trying to do.
My guest is Dr. Burruss. He is the CEO of Whittaker here in Dallas, and you have a very large department, Doctor. Dallas County is a big place.
It is. It's about 2.7 million people in Dallas County, and people are moving here and being born here every day. So Whittaker has to be pretty large to be ready to address that need. We have about 1,000 staff, and we have some opportunities for employment if anybody's looking who has a background in mental health. We also have a treatment program where if you arrive today at one of our clinics and need to be seen today, we'll see you today. So you
can see us today. Now that's some groundbreaking news right there, Doctor.
Yeah, it takes hard work. I have to say how proud I am of all of our staff for being able to make that happen. But we're aware that if we turn you away on the day you finally decide to get help, then only bad things can happen. So we're going to be ready to see you today and every day if people show up at our clinics today. If you call for an appointment, we can usually get you in within a week to 10 days.
Would you do us a favor? Give us just a brief synopsis of who you are and where you come from. Why is this position so important to you? We just want to know a little bit more about you.
Oh, thanks for that opportunity. So I'm a psychiatrist. I am a lifelong Texan. I only spent 1 year elsewhere. I did my internship in Cincinnati, but I've been here the rest of the time. I spent a couple of decades down in Houston at Ben Taub Hospital, which is much like, it's like Parkland for those of you who know Dallas well. And about 10 years ago, I came and interviewed for this job, and what the board of Whittaker wanted to do was really attractive. And that's not just to maintain this level of service, but also to do teaching and research and help build the population of workforce, the people who are going to take our places when I get too old to do this, and the research that shows how best to treat people. And that was appealing to me. So I came up here in 2013 and have loved every minute of it. It's been a great ride, even though some of those minutes have been difficult. And we're excited to see what's happening. The future is great for Whittaker. We're growing. We're adding staff. We're adding buildings. We're adding access points so that the ideal is that you can get help in your neighborhood, wherever you happen to be. Whichever neighborhood in Dallas is yours, we want to be close by so that you don't have to overcome more hurdles to get to our services.
Well, I guess the question that comes to my mind first is the diversity that Dallas has. You've got all of the nation's people in one big city. And as you mentioned earlier, we're growing extremely fast. So how are you keeping up with the numbers, and how are you handling the diversity?
Well, diversity means different things to different people, but we do our best to have a population of clinicians and staff who look like the population that seeks help from us.
Excellent.
And so that we try very hard to parallel Dallas County. And that includes everything from the way I appear to the language I speak to my cultural and family beliefs. And how do we take care of folks regardless of where they come from? The other thing is there's financial disparities. There's people who struggle to get help because of financial reasons. And MetroCare is there for everyone. I'm going to repeat that. MetroCare is there for anyone and everyone. Anybody
well, thank
who shows
you for
up.
repeating. Thank you so much for repeating that.
Well, it's important. Everybody who shows up. If you show up, we'll find a way to get you help, regardless of whether you have insurance or Medicaid or any other way to pay for it.
Do you agree with the statement that we hear a lot on mainstream broadcasts? 1 in 4 people have some form of mental illness. What are your thoughts about that?
No, I do agree. That data has been proven repeatedly in good trials, good research trials. Mm-hmm. And so that doesn't mean that every single one of those people is experiencing an acute flare-up of that mental illness right that moment, but it means that 1 in 4 have been or are currently diagnosed with a mental illness. The data on who's suffering right this moment is about half that. It's about about 12%, about 1 in 8, I think is what that is, that are right this minute suffering with some symptoms of a mental illness.
Well, that makes us feel a little bit better. I want you to know how much we do actually, indeed, appreciate this time. Now, you came on, and I don't know how much time you have, but I do have a couple of other people on the air with us right now. Can you spare us and give us another at least 10 minutes? I
can, yes.
Great. Deborah Blair Abrams is on. She is with the Elite News, which is one of our longest-running newspapers in Dallas County. I have on, I think her son is on, that would be Casey. Casey is on his computer because Miss Deborah runs another show called On Assignment. So we're trying to get you all covered all at one time. I have to maximize my opportunity with you, Dr. Burruss.
Efficiency is good.
And I want to say thank you to Tate for being so cooperative, because when you get a busy person, a CEO of MetroCare, we have to make sure we cover all of our bases. Miss Deborah, do you have anything for Dr. Burruss?
Yes, Dr. Burruss. Can you hear me pretty good?
I sure can, and it's good to hear your voice. You and I and Casey have actually met earlier at a press conference that the North Texas Commission held, so it's good to hear you again.
Oh, super great. I'm just so glad that you're here, and I'll just get straight to the point because I see now that we're going to be seeing each other and talking much more in the future. One of the things that I'm very concerned about is the mental illness, people being, patients are not being recognized and targeted. You have mental illness, people that are getting, are killed by different people because they're not recognizing their mental illness. I mean, how can we recognize this mental illness, be more aware of it?
What a great question, Ms. Abrams. And it is a tragedy when, whether it's because a peace officer gets frightened about somebody's behavior, or as happened in New York just recently, some, people in transit get frightened about something. And it's usually fear that, sometimes it's other things, but usually it's fear. It's somebody's behaving in a way that becomes threatening or frightening or or some other thing that, makes people uncomfortable. So the more we can help the community know that sometimes behavior can be upsetting for a lot of reasons, including if we're around people who have seizures. It's very upsetting when they have seizures. If we're around people with diabetes and they pass out because their sugar got too low, so behavior gets to be upsetting in a lot of circumstances. The more we can come to understand that sometimes it's not because somebody's bad, it's because somebody's currently having a crisis. And then how do we approach that? One of the great things that's happening in our community, and these things take time, but one of the great things that's happening in our community is to train the peace officers and the first responders, paramedics, fire folks, otherwise.
That's right. Now
to train them in how to approach these situations so it doesn't escalate. Because escalation never helps anybody. People get hurt, people die if you don't handle things well.
And, this is just across the board, it affects everyone, all peoples of all colors and all walks of life, whether you're rich or whether you're poor. So one of the things that, I hear people say a lot, if you recommend them going to see a psychiatrist or go to a doctor and see whether this is something that is, were you born with this? Is this a medical imbalance or something of that nature? They don't want to be called, I'm not crazy, And so, how do you approach a person and say, hey, we'd like to get you some help, and let's go, check this facility out, go see Dr. John W. Burruss and check him out and let him talk with you. I don't know if that's the correct way that we would approach them.
That's that lingering stigma of, well, I've had people who are like, I'd rather have cancer than be crazy. Well, being mentally ill, having panic attacks, having depression, having anxiety, having bipolar disorder, is every bit as, it's actually more treatable in many cases than cancer, than other kinds of conditions, even simple conditions. So I think one of the ways is to help people understand there's help. There's help that has good outcomes. So it's not a lifetime sentence.
That's the greatest message. That's the greatest message you could possibly give to us.
There is help.
That if you come, you will be waited on. One of the questions I must have you answer is about your budget. We've had a lot of discussion in Dallas County over the years about the budget. And do we have enough money for all of the things that your department needs? You mentioned new locations. We talked about stigma.
Yeah.
We talked about the police department. In fact, I can remember when we had one of our police chiefs recognize the need for his people to be trained. Now that he's no longer the police chief. We're probably 3-4 down the road right now. But where are we, Dr. Burruss, on our budget, taking the needs of this great city? And part 2 of that question is, where are we with training our fire department, our disabilities? We haven't talked anything about disability. So what is our budget like?
Let's start with budget. The reality is that we don't get a lot of money from the county or the state to do what we do. We get some. And let me begin. At the highest level, of course, there's never enough. Right? When you're talking about trying to deliver services to people who are usually poor and not always able to pay, you're always scrapping to find enough money and resources to do it. So there's never enough. The state has been more generous, certainly over the last 10 years, in trying to understand and support these conditions. Okay. That doesn't mean that we're at the top of the United States, but it means we're realizing that these are important investments. The county puts money into it. They've helped support MetroCare in important ways in the recent past, including to create new access points in campuses. But, the competition is fierce. The school districts need money. The roads and bridges need money. Everything needs resources, and there's only so many resources to go around. So we're going to keep fighting to make sure that we do the best we can and are the most efficient with what we do have. And a lot of what we have is things like Medicaid. Having Medicaid to be able to pay for some folks who've got medical conditions of all kinds is really very important. That's a key payer source for us. But, trying to seek all those options. That's one of the things I mentioned earlier is if you just walk in, we have staff on site at every one of our locations to try to figure out, are you eligible for anything? Are you eligible for some kind of payer source? And if so, great, let's take advantage of that. Even if we can't, we're still going to be able to take care of you. But if we can, let's take advantage of those things to pay for it. Now, the peace officers and first responders, one of the things people often lose sight of, there are huge numbers of peace officers in Dallas County.
Yes, there are.
Dallas Police Department is here. The Dallas County Sheriffs are here. But there's probably 30 or 40 other peace officers, from Parkland Police to Southwestern University, or Southwestern Medical Centers Police to Irving Police to the constables to filtering this all out is happening. And it's happening. It's being supported by the state through TCOL, the Texas Commission on Law Enforcement, which is the state police commissioners, and they're expecting jurisdictions to include this training. And that's great. And then, as time goes by and we have enough opportunity to get officers trained, we're getting there. Same for paramedics and firefighters. They're often the first ones on the scene. And there's more and more training going on. Plus there are special programs, like there's a program called Right Care. Right Care is a program where if a call comes into 911 with a high likelihood that it's a mental health call, a team will go out that includes a peace officer, a paramedic, and a social worker.
Are you saying Right Care or Right Care?
Oh, right. Like my right hand.
Okay.
R-I-G-H-T, yeah. So Right Care sends this team rather than sending people who might be responding to a burglary or something like that. This team is well equipped to get there and determine what's driving this situation. Is it somebody who needs to be seen by their psychiatrist? Great, let's get them to MetroCare. If it's somebody who has a medical condition, the paramedic's there for that. If it's somebody who, unfortunately has outstanding warrants or whatever, the peace officer's there. So but it brings an option rather than let's just go to jail.
Wow, that is great.
It is great. It is great. I just really, my heart goes out to people that have mental issues. Our governor was just saying the other day that he felt like some of the crimes that are being committed are committed by people with mental illness. I don't know if I totally agree with that, because I think that's a bad rap. I believe that is it's hate. I just don't believe that mental illness is the reason why people these mass shootings are being brought about. Not all of them. I just don't think so. And I think that they're getting a bad name, mental illness, about mass shootings.
Dr. Burruss, we got one or two more questions. You've been with us now about 15 or 16 minutes. I know Tate is there. She can let us know if there was a question that we should have asked. And we would like to be able to call on you again before Mental Health Month is gone. Somebody just logged on.
That's me. Tate Reader here with MetroCare.
Okay. Let's see, I have two other people on, and that would be from the military side of the house. That would be Will Michaels. Will, you have any questions for the great doctor about the veterans?
Yeah. I think that's the field that we can get into because, like I said, I know the veterans. But Ms. Davis, I'd like to thank Dr. Burruss for give me the information to be able to talk to Tate, because I think we're making a big impact as far as when it comes to these kids, because Tate's been out there in the trenches with us. And the question that was said was about mental health. Me, Tate, and Mike, my partner Mike, now we've been out there, we've been talking to these kids. Some of these kids, Tate was able, she was with them. I think that a lot of these kids, some of these kids need help, and they're reaching out there and they're asking for help. And I think that right now, you know, saying we put them in a good position. You know, saying just about a few people that we had come, just the event we did the other day, Tate sat down with them, and some of these kids, I mean, they don't want to talk about it, but if you talk to them one-on-one or if you got comfortable with them, shoot, they tell you exactly how they feel. And some of them, shoot, what do you think, Tate? Some of them, wow, you know.
That's amazing. Now, what did you
I
guys
think
know?
that you said the question
did.
Oh,
I'm sorry.
Sorry?
Go ahead, Tate.
So, you know, the one of the questions you asked us, Ms. Davis, before we got on the show today was about youth and the surprising, just the astronomical rates of black male suicide. And that's something that you said, what are we concerned about? What are we looking at? What do we want to change? Dr. Burruss this is very near and dear to his heart and something that he's focusing our efforts on. And Dr. Burruss, you want to talk a little bit about that?
Please.
You bet. Yeah, and Will, good to hear your voice. You and I hadn't spoken in a couple months, and I'm glad you're out there because I've seen some of the videos that you and Mike are doing, and I think that I can't say how important I think that is to get that one-on-one, those small groups, a couple kids at a time, and get them talking because that's a key to this. So what Tate was talking about is for decades, like when I trained, there was data that suggested that young people of color, particularly black and Hispanic people, and particularly males, did not kill themselves at any significant rate. Yes, it would happen, but it was very, very rare compared to some of the other groups. And over the last decade to 12, 14 years, that has changed. And we're starting to see more and more suicide and suicidal behavior amongst younger black and Hispanic, particularly males.
Wow.
These 12, 13, 14-year-old kids. And it's a clear sign of a group that's starting to really have powerful struggles that we need to pay attention to. So I think what Will and Mike are doing is a key to that. Tate and I have had that conversation. God, in the last week, we've talked about how that's a pivotal piece.
Well, I think we just want to help wherever we can. Deborah and I are writers. We have C.W. Whittaker on with us who put us all together with an 800 number. And we just need to know what it is that we can zero in on. What is paramount about this, as you call it, this powerful struggle in our society?
And can I say something, Ms. Davis? And one of the things that I like about Whittaker is we're able to get out there to these kids and they talk about is the 988. A lot of people don't even with me, I never knew about 988. If you got a crisis,
tell us about 988. Tell us about it.
I'm going to Tate do that.
Okay.
Yes, we have that on our program as well, Esther.
Okay.
A lot of people don't even know about that.
Yeah, I can do it.
Right.
So
yeah, go ahead.
Last summer, the United States across the entire country rolled out 988. It's similar. It's like 911 or 311. 988 is now a 3-digit number you can dial on any phone and reach mental health resources right now. So it's a way to remember without having to remember a crisis hotline or any larger number. It's a way to get access to services that are specific to your region. So the 988 number, if you call from Dallas, if you happen to be in Dallas and you call, they're going to give you Dallas area resources as opposed to having to figure out where you are and all that.
Oh,
plus
excellent.
they've got immediate, And this has only been around, it hadn't even been a year yet. So you're right. A lot of people just don't even know this exists.
Well, that's one thing we can help do. We can get that number out and have people into the churches and but I do get very, very concerned about our young people growing up with these mental, I don't know what you call them, with these mental problems and they're not being solved. So if you can reach them, we can help you.
And if it's not a crisis, but someone's still struggling, anyone can go to our website, metrocareservices.org, and the locations page. And the crisis number's up there, and you just pick a location, you call a clinic, or you see the address, and you can, all of them are accessible by DART. and like Dr. Burruss said, we'll see you same day, or you can call and set an appointment. And we see children and teens and adults. So metrocareservices.org for anyone who's listening and says, yeah, now's the day that I've been feeling this way for a long time now, and now I want to reach out.
Metrocare.org.
Metrocare Services. Metrocareservices.org.
The 988 number is one I'm told it. Will, are you? Yes, go ahead, Will.
Yes. And another thing, among us too, like I said, the inner city, whatnot, we need to know the difference between mental health and mental illness, because I never even knew, because when you're talking to a person and you're constantly putting it on about mental illness, they don't have a mental illness, they're working with mental health. So sometimes we get to talking about stuff too deep into, the conversation and talk about stuff that we ain't got no business talking to somebody that has mental health per se to somebody that got mental illness. And Tate, it brought that to my attention too, where I said, wow, wow, I didn't know that. So I think that is a lot of stuff that, while I was working with Tate and Dr. Burruss, saying we're able to get out there to these youngsters and they listen. Dr. Burruss said when we did the interviews or whatnot, these kids are expressing themselves, but what we have to do is we have to get them in smaller groups right now, then turn around and get them in the bigger groups. So they're not going to stay down in the bigger groups because they're labeled as a nerd or whatnot, and we can't do that. But if we keep them in small groups like we did, they'll talk all day. Cause like saying the other day when Tate sat down with that young lady, Tate sat down with her, and they express their feelings, but as long as there's a big group, they're not going to do it. Is that correct, Tate?
Wow.
Okay, everybody. Okay, we are approaching about 30 minutes, and I don't want to keep Dr. Burruss because I really want him to come back and know that we honor his time with us today. Dr. Burruss, would you give us a closing statement and a challenge in that statement, please?
Sure, and I'm happy to come back and talk further about this issue. You'll be sorry you asked me because I'll just keep going on and on and on. So our closing statement, we've come a long way, but we've got a long way to go. There are a huge number of people struggling with mental illness questions, whether it's anxiety or depression or substance use or eating disorders or bipolar disorder, what have you. And there's help to be had. There are important treatments that can make your life manageable or even excellent. There's people who can achieve things that they didn't even realize they could achieve by overcoming some of these things. The challenge is, let's get the word out. Let's help people of all varieties, people of every persuasion and every diverse pocket of our community to understand that there's help out there. It doesn't matter if you got money. It doesn't matter what you look like. It doesn't matter what you're struggling with. We can step in, and there's good outcomes to be had.
Thank you, sir. We just so appreciate who you are and what you're doing, along with your entire staff. Hey, everybody. This is Esther Davis with the Esther Davis Show. I want to say thank you to Deborah Blair Abrams. We're on her show also. We're trying to maximize the information that we're giving to you. I'm going to close. I've got to go. But in the meantime, let's just be good to each other. Thank you so much.
All right. Thank you, too, Ms. Davis.
Thank you.
Thank you.
Here. Well done, everybody.
All right.
Tate, Mr. Burruss.
We'll talk soon.
Thank you so much,
Bye-bye.
Deborah and Esther. Really appreciate what you do in your platform and spreading the word. And we're really grateful for the opportunity.
Yes, I'm very excited and touched my heart to work with you guys continuously.
Yeah.
Thank you so much.
We'll make it happen.
Goodbye, all.
Bye-bye.
Bye-bye now.